So today we're going a little backwards today. I know we're working on week 3 in our insurance Fordney book. So we're going to go a little bit backwards and then we're going to come forward. And then this is going to be question and answer time at the same time. So I think week 1, I'll try to catch that up in a little bit. So we got about, we don't have much time. We got about 15, 20 minutes. So I want to go forward as much as I can. Today, we're going to talk about Medicare. We're going to talk about Medicare today, chapter 12. Let me add up a bit. Okay. Okay, good. Okay, so chapter 12. Okay. In your Fordney book. And then this is one that you know of that's on Medicare. Yeah, grandma, grandpa, big mama, big daddy, Madil. Okay. All right. So let's talk about that. Medicare is a governmental insurance. Okay, so governmental insurance. Okay, you have Plan A. You have Medicare. Oh, not Plan A. Sorry, wrong terminology. You have Medicare Part A. You have Medicare Part B. You have Medicare Part D. Okay, they do have C and other places like that, E and F for dental stuff like that. Hi, Mr. Jackson. How are you? Oh man, lockdown. Oh, I just knew I was gonna be off the chain with that. So I'm all clinked up. I'm all clinked up. Man, thank you, Mr. Jackson. Okay. So Medicare Part A is for hospitalization. Hospitalization. Okay. And Part B is for physician care. Okay. Part D is for prescription coverage. Okay. All right. What's today's date? 17. Oh, today is Constitutional Day. Okay. Dun, dun, dun. Okay. All right. So we understand. Let's look through the book here in chapter 12 in our Fordney book. Okay. Okay, so everybody has their insurance handbook for Fordney. Okay, remember we're doing this. Remember, I sometimes go kindergarten style because I have to get y'all to understand the illustration of what I'm talking about. Okay, now we're going to be looking at chapter 12 in your insurance handbook. Chapter 12, we're going to talk about Medicare. Okay, everybody should be on chapter 12. Okay. 390. In your handbook, not your workbook, your handbook. Your Fordney Insurance Handbook, your red and white book. Page 390. Very good, you got it. Daylight coming, you wanna go home. I'm sorry, I had this book on top of my head. I feel like I'm carrying a basket full of bananas. Daylight coming, you wanna go home. Okay, everybody on the same page with me? Okay, fantastic. All right, my loves. So it says here that after reading this chapter, you should be, I'm just going to pick out a few things. Explain the eligibility criteria for Medicare. I'm reading on number 9. I'm just picking out a few. State the name of the federal act applicable to reducing fraud and abuse. Number 12, Define and discuss a Medicare mandate prepayment screen. Number 13, discuss 3 initiatives and how they affect Medicare. Number 16, determine the time limit requirements for transmitting a Medicare claim. Real important. Number 19, discuss the 2 ways in which to submit billing for a deceased patient. Oh my goodness. Number 20, state the components of a Medicare remittance advice. Medicare remittance advice is the same as an EOB, okay? It's just governmental EOB, okay? But it's called a remittance advice. Post information on the patient's financial accounting record after Medicare payment has been received. So we're going to talk about all that. Okay, so the background. Let's read the background. It says right here for the background, although Social Security is one of the United States' important domestic programs, this system is by no means the first. A number of social insurance programs existed throughout Europe and Latin America before the Social Security Act was signed into law in 1935. Before the United States had Social Security, 20 other nations already had similar systems in operation. Another 30 countries had different social insurance programs in place, such as workers' compensation. So, policies and regulations. Medicare is administered by the Centers of Medicare and Medicaid Services. It is divided into 3 divisions of the following responsibilities. The Centers for Medicare Management oversees traditional fee-for-service Medicare. The Centers for Beneficiary Choices provides beneficiaries with information on Medicare, Medicare Select, and Medicare Plus choice programs and Medigap. It also manages the Medicare and Choice Plans, consumer research, and grievance and appeals functions. The Centers for Medicaid and State Operations focuses on federal state programs such as Medicaid, the State Children's Health Insurance Plan, which is known as CHIPS, insurance regulations, and the Clinical Laboratory Improvement Amendments. CMS also enforces the insurance portability and transaction and code set requirements for health insurance and portability and accountability. So here's the eligibility requirements for Medicare. So let's jump down a bit. Well, I'm gonna read the whole paragraph. I think it makes sense. The Social Security Administration offices take applications for Social Security, control the eligibility process, and provide information about the Medicare program. If an individual already receives Social Security or railroad retirement benefits, he or she are automatically enrolled in Medicare Parts A and B starting on the first day of the month that the individual turns 65 years of age and enough applicable work credits that are equal to 10 years of full-time credit. In 2000, the retirement age gradually increased for people born in 1938 or later. By 2027, full-time retirement will be 67 for people born after 1959. Benefits may increase if retirement is delayed beyond full retirement age. As of this edition, Medicare still may begin at age 65. Those who apply for Social Security early at age 62 years do not receive Medicare but receive monthly reduced Social Security benefits. If an individual is younger than 65 years of age and disabled, he or she will automatically get Medicare Parts A and B after getting Social Security disability or railroad retirement benefits for 24 months. An individual does not have an individual does not have to be retired to receive. Here's some of the eligibility requirements. Okay, people 65 years of age or older who are on Social Security, people who are 65 years of age, Social Security disability, and who are in the following categories. So if they're disabled, disabled means disabled workers of any age, disabled widows of workers who are fully or currently insured through federal government, blah, 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 blah. C, adults disabled before 18 years of age whose parents are eligible for retired on on Social Security benefits. Children and adults who have chronic kidney disease requiring dialysis or who have end-stage renal disease. That's why you have those kidney dialysis places, a lot of those kidney dialysis places. Oh, okay. Okay. So she was automatically qualified. Yeah. Okay. Kidney donors, all expenses related to the kidney transplantation are covered. So if a person is donating a kidney, then they are automatically covered under Medicare. Okay. So the question is, and it may ask you at some point during your assignment, or should have asked you, what are some of the requirements or eligibility for Medicare? It could be any one of these five or any one of those three things that's listed in number 3. Okay, are y'all getting that? So you may want to highlight some things in your book. How many of y'all have highlighters? So highlight that. And these are some, bless your heart.
I know. I had cough, but they didn't.
Oh, okay.
It's like one of those coughs that don't come all the way out, and I still feel itchy each time I cough.
I have some cough drops. Would you like some? Okay, give me just a minute. The eligibility requirements.
Oh.
All the eligibility requirements. Because you need to know that, so in case you work for Harris County Hospital District, in case you work for any facility that's gonna assist you on knowing that, then you'll know it, or at least be familiar with it. They're gonna always have cheat sheets to let y'all know that this is what it is, but at least you'll be familiar with it from the classroom standpoint.
Chris said he's not feeling going live.
Yes, tell them I'm doing live.
He did it on the.
Oh, okay, okay. I didn't. Yeah, I just asked him. This is all I had left. I'm so sorry.
Yeah, no, I had a bunch too.
Yeah.
It worked.
Yeah.
I've never ate a cough.
Oh, it works.
Yeah.
Yeah, it works.
No, they're not.
Oh, bless you. Okay, honey, don't chew them. Just suck on it. It kind of helps soothe that cough. Oh, bless your heart, baby. You done ate plenty of candy. Plenty of candy. Okay, well, don't treat it as medicine, not candy. Okay. Oh, okay. So is it Constitution time? Come on in, Sweet Pea. Hey, baby.
I'm gonna put the cakes out.
Okay, let me. Who?
10 minutes.
Huh?
Come on down about 10 minutes.
Okay. Let me ask. Can I get a student to help her with the cakes? Okay. Just help her load it on the push. Well, I want you to stay for the lesson. I want you to stay for the lesson. Okay. So go and help her in the library because I want you to really get this. Yeah, help her and then take it down there, and then if you could help start her cutting the cake, that'd be great. Yeah, because her back is kind of really bothering her. Thank you, sweetie. Extra points for you. Okay. Okay, so let's look at this. That's sweet of you to want to help. That is. That's sweet. Okay, all persons who meet the previously stated eligibility requirements determined the SSA are eligible for Medicare Part A, Part B, increasing basic premiums to the SSA.
Chris said
and
to say hello.
Oh, hey Chris, what's up, dude? What's up? I hope you getting that lesson, because you know I might do a pop quiz on Wednesday. So be ready. Okay? Okay. Thank you. Okay. Anyway, you know I'm just kidding. But I might do that for real though. I might do that for real. Might. Operative word is might. You hear Kayla? She talking about might. Okay. So anyway, So let's look at this. Okay, so Medicare Part A, Part B. So let's look at page 393. It has letters after the Medicare number on the patient's identification card indicate the patient's status as follows.
Oh, he said, "Oh no, might not pop up, might not."
Chris got a joke for everything.
No, I might not pop up.
Whatever, dude. I'm not worried about you. Bye, Chris. Bye. Bless his heart. Okay. This right here, A, wage earner. That's what that means. So if you see a person's social security number and it has an A at the end, that means that they are still working. They're getting social security, but they still working. Okay. If you see B behind the policy number, that means a husband's number, a wife 62 years or older. Okay, so she's using her husband's Medicare, but it has Part B behind the Social Security number. Okay.
Part A, that means that they're getting Social Security and they're working at the same.
Yeah.
And then B is they're getting Social Security from someone else, like
their spouse. Their spouse. Mm-hmm.
And
so
because they're deceased.
Be alive. Let's suppose, okay, and Johnny Mae has been a homemaker all her life. Okay, she never had to work, wanted to work. She just was a homemaker. Okay, but her husband did all the work. So now he's 67 and she's 62. So now that she's 62, she's on her husband's benefit. You know, she's getting Social Security under her husband's insurance. Social Security is not just the SSI check alone, it's also the benefits of insurance coverage. So when she goes to the doctor, she's going to present this Social Security card, just like this picture you see on page 393. And instead of it being an A at the end, it's going to say B. Okay, it's just like your spouse is the policy holder for the family. It works just that same way. The only difference is B just lets you know that she's a dependent. Does that make sense? Okay, she's a dependent. Now, if it has a Social Security number and it has a D at the end, then that means okay. And so that kind of fell in line with my grandmother when my grandfather passed away in 88. Okay. It had a D at the end of her Social Security card. Did you hear me?
She said you was gonna come down there and cut it with her. Okay, look, it's a testing.
Okay.
She said to take it and she was like, so that was the first person.
Okay. In the